Sounds like a Texan.
What's going on, everyone? Welcome to Ask Dr. Jeff, the interactive Zoom platform where we discuss all things photobiomodulation and Lifewave patch technology. My name is Dr. Jeffrey Hubbard. I'm your host and facilitator. I'm a medical doctor and entrepreneur here in the Dallas-Fort Worth Metroplex. It is my honor and my pleasure to share space with you. I always enjoy our Tuesday evening meetings where we open the floor for questions that I hopefully can answer and provide some insight and direction about how to utilize the technology. The technology we're referring to is one of these bad boys. This is a photobiomodulation patch. It is produced by a company called Lifewave. Lifewave has been in existence since 2004. They're based in Western Ireland, but they have distribution centers all around the world, servicing 75 different countries. Really dynamic and futuristic biotechnology company that is altering the way that our bodies function with this small patch, right? It's about the size of the United States quarter. There in the center, you can see there is a fiber mesh. This particular patch, the X39 is our most popular patch. What happens is that there is a proprietary blend of organic materials that is placed on that fabric mesh. And when it comes in close proximity to your body, within 1 inch or so, it is activated by our body heat. Now, ladies and gentlemen, unbeknownst to me, 2+ years ago, I had no idea about photobiomodulation or the fact that our body heat is actually a form of light. That's correct. It is a form of near infrared light, which is on the right side of the visual spectrum. As human beings, our ability to see light is very narrow with the human eye, but there are lots of light that we are influenced by, but cannot necessarily see. And this near infrared light is one of those types of frequencies. And interestingly, this is not unique to Lifewave. Photobiomodulation is used by a bunch of different companies with a bunch of different technologies. The sun itself is a form of photobiomodulation. When you stand in the sun for long periods of time, you increase your melanin deposits, which means that your skin complexion becomes darker, AKA a suntan. Also, the most effective way to raise our circulating vitamin D levels is through synthesis from sunlight. Yes, that is correct. Sunlight is a form of near infrared light as well. So this X39 patch reflects this near infrared frequency from our body heat back into our skin, and it induces our body to produce a molecule called GHK copper peptide. Very, very dynamic molecule. It's been studied since the early 1970s. So many different research studies and articles about its efficacy and how it works, this mechanism of action, which is to alter gene expression. So every day our body is using our DNA to produce proteins. These proteins go off into the world of biology and do their respective things. So what this GHK copper peptide does, it influences the production of those key proteins in certain situations, either to increase them or decrease them in an effort to bring the body into its best state of being. One of the downstream effects of this gene expression is the increase in activity of stem cells. Now, these are undifferentiated pluripotent stem cells. What does that mean, Dr. Jeff? It simply means these cells have yet to determine what type of adult cell they would like to be. So they're circulating, looking for inflammation, looking for damaged tissue, looking for otherwise compromised cells so that they can go in and replace them and become a heart cell, a lung cell, a artery cell, a kidney cell, a stomach cell. Any of those particular instances, these undifferentiated stem cells are capable of replacing those cells that need to be replaced. All right, so what's the result? Guys, on a cellular level, it simply means that your cells are going to be optimized. They're going to be functioning at all cylinders. They're going to be very healthy and young and vibrant. Now, on the surface, how you feel is really interesting. It's unique to each person, but primarily, you're going to feel energetic. You're going to feel vivacious and vibrant. You're going to sleep really well. Your general functions as an adult are going to improve. Some more common things that happen is cognitive improvement, simply meaning you function mentally much sharper. Your memory is better, your focus is better, you get things done. Your gastrointestinal system is really improved. You absorb food better. You're energized by certain meals and drinks and things that you may introduce into the system. Your cardiovascular system, your heart remodels, your blood vessels improve, your atherosclerosis or plaque buildup, it is reduced. Your blood pressure seems to normalize itself. I mean, there's the list of things goes on and on and on. One of the primary reasons most of our Lifewave family are interested in X39 is because it just makes their joints feel better. It makes aches and pains go away. You feel like a younger version of yourself. So I can attest to that. That is what I experienced personally. Professionally, I have seen so many different things in regards to utilizing the patches. And here it is. We've been doing, it's our 81st episode of Ask Dr. Jeff, and we're still introducing new and interesting testimonials and experiences just with X39 by itself, let alone with all the other patches. So guys, excited as always to discuss this amazing technology and to provide resource on how to best utilize it, all right? So we've been doing our anatomy sort of lecture series. We started off with the knee. We covered the shoulder last week. This week, we're gonna cover the abdomen, all right? And so I'm gonna stand up so you can kind of visualize the abdomen. You're gonna cut it into 4 pieces, all right? This is the upper quadrant is this area up here, and then we have the lower quadrant here. So if you split it down the middle and across, you have an upper left quadrant, an upper right quadrant, a lower left quadrant, and a lower right quadrant. Right? Now, obviously, you're looking at me the other way, so just follow me. This is my right, this is my left, this is my right, this is my left. So upper quadrant, lower quadrant. All right, so when we're examining the abdomen and trying to find out what may be going on, we have to visualize the organs that are in those various different quadrants, all right? So if we look at the upper left quadrant, I want you to think stomach, and I want you to think large intestine, all right? So the large intestine basically moves up and across, all right? Up and across. Okay, so the 2 upper quadrants are going to be stomach and large intestine, and then liver and large intestine. All right, so generally that's the major organs: liver, large intestine, and this is stomach and large intestine. All right, as we drop down to the left lower quadrant, all right, this is going to be your appendix and your small intestine. All right, so within this portion here is mostly small intestine. So your large intestine comes up and around, your small intestine is confined in between there. All right, so also here in the upper right quadrant, sometimes left quadrant, is pancreas. All right, so pancreas is going to kind of sit just adjacent to the stomach. It's going to cross over the midline. Okay. And then right side, right lower quadrant is going to be spleen. It's going to be large intestine. And again, you're going to have some small intestine involvement, but also this is going to be where most of your constipation and jams in the holes are going to take place in your sigmoid colon as it's going out. Okay, so this is the anatomy. Stomach, liver, spleen, appendix, and large intestine. All right. So when you're thinking about patching for abdominal issues, all right, think about the epigastric area, just below the sternum, all right? That's going to be where your esophagus comes down and eventually goes into the stomach. That's a place where you're going to experience reflux, burn, all of those sorts of things. Carnosine is great for any sort of indigestion, any sort of bloating or swelling in the stomach or esophagus, any problems with swallowing. That's a great place. Carnosine, glutathione is great there. Any of the Y age group, right there at the bottom of the sternum, just adjacent to the stomach. All right, that's a great place. If you're dealing with any fluctuations in bowel movements and you feel like either you may have an infection and your stool is very loose, or you are backed up and your stool is very dry and it's hard to pass. We talked about the triangular positioning of the patches. Again, this is my umbilicus or my navel. You can just come right on either side of it, and that's the base of the triangle, and then it should be this shape. All right. So you can do ice wave or energy enhancer on either side, tan on the left, white on the right. Or you can say glutathione and eon, or SP6 and glutathione. All of those are really dynamic for minimizing inflammation and challenges with your gut biome in your gut. Glutathione, eon, X39 is great, actually. Alavita is great, actually. Any combination of those patches on the abdomen is going to be really strong for bloating, for weight loss, for indigestion, for maybe some constipation or slow bowel movements, or maybe your bowel movements are a little too quick. Maybe they're a little aggressive. You just need to slow down some of that inflammation, or maybe modulate your immune response to something that's going on in the gut. So great sort of dynamic, but those particular points, again, on either side of the umbilicus, and then traversing down or traversing up. So we talked about the epigastrus. So if you want your triangle to point the opposite direction, right? So here's either side of my navel. If you wanted to come here to the epigastric and say, here's your carnosine, and then you have ice wave on either side, or here's your glutathione and you have carnosine, ice wave or energy on either side. That works just the same as if you start the base here and traverse down, all right? Hope that's making sense, guys. Just wanted to kind of give some insight. I think anatomically, when I'm thinking about the patches, but that's not to say that you are. And so you may be patching somewhere just because that's where spirit told you to patch, or that's, something that you've heard through the grapevine of Lifewave about where to patch. But if you start recognizing where these organs are and what you're patching for, then somebody who's got gallbladder issues, or somebody who's got liver issues, or somebody who's got stomach issues, or somebody who's got changes to their bowel movements or whatever, you can begin to anatomically find a location that you think would be valuable. And then you can just mix and match some of those patches that I mentioned and see how the magic works, because they really do some excellent things. All right, so I have about 15 minutes to the hour, right on time. We can go ahead and begin our question and answer period As always, I need to state this disclaimer that this is not medical advice. These patches are not approved by the Food and Drug Administration as a type 2 medical device. They are a wellness product. They bring the body into homeostatic balance. That is how these patches are effective in helping the body to be in a better state of health. Okay. And so, they do not heal, treat, cure, or prevent any illness. They simply help the body to be in a better position to heal itself. There's a reaction icon on the bottom of the screen to the right that has a smiley face and a plus sign. That is your reactions icon. That will allow you to raise your hand or clap your hands or send me a heart or a smiley face or whatever you might be interested in. But specifically for question and answer, it allows you to raise your hand and gives you a place in line and helps me to find out where you are when I'm ready to call on you. All right. So if you know that you have a question at this particular moment, you can go ahead and use that reaction icon to be able to raise your hand. If some point in time during the discussion, you find a question is coming up and you'd like to ask it, you can raise your hand. All right. Thanks so much for your attention. And we're going to start the Q&A with Ray. What's going on, sir?
Hey, Doc.
Yes,
How you
sir.
doing, everybody?
I'm doing
This is simplicity, but you help me out with this. So we get a lot about how X39, most of the patches work, but I wanted to be specific on how the Icewave, let's see how I phrase this question. The nano antenna activity crystals in the patch, in the mesh, what are they telling the body?
the Icewave.
Yes.
So Icewave and energy
Right.
are really based upon, they're very similar. They came out around the same time. This was David Schmidt's first real patch invention was, how do I move the flow of qi? So the understanding in traditional Chinese medicine is that when qi, or the flow of our energy source, is stagnated, it allows for disease to develop. So they believe that is the catalyst to dis-ease, or the body being out of alignment, out of balance. So what these patches are designed to do is to shift that energy and to be able to let it flow freely again. And so that the idea behind that is, if I can flow this tight and stagnated energy, then the pain should go away, because the pain is the holding of the stagnated energy. So, I think of it like this, Ray, interestingly, is that, when you get an acupressure massage or you get acupuncture, you are stimulating those particular points to release because they're tight.
Okay. Yeah.
So you see the needle moving once it's been placed at acupuncture. That is the qi leaving or moving. It's moving that needle. And so similarly, if you're using a thumb or a knuckle or elbow in acupressure, you can feel, in many instances, you can feel the muscle release.
Right.
You can feel some of the posturing that the person may be holding release when you are manipulating those particular points. So I see it very similarly, that the energy enhancer and the Icewave, similarly but different, because they're doing two different things, but they're releasing that flow of energy, and thus you have less pain, less inflammation, less tightness. A lot of people are just tight, and you put on Icewave and it's like, oh,
okay.
So they may be carrying pain because they're tense, but they're not even recognizing that their posture is such. So once you put the patches on and they begin to release it, then it's like, oh, I'm comfortable again. I've never been able to release my shoulders. I haven't been able to release my neck. I haven't been able to release my lower back or my wrist joint or whatever the case may be.
So in layman's terms, you're just saying by it being able to energy in, energy out, both of them, but then there's a different link, a wavelength that deals with pain specifically.
That's the understanding, yes.
Right. And so, and I asked that because although, you know, I've been involved with it for a while, I went to the dentist today and, you know, had a cap. Well, I had to have a cap replaced, but they did it all in one day. Phenomenal science. But anyway, but they worked so hard on my jaw.
Yeah.
You know, it was, and he said, you're going to need some ibuprofen. And I had a patch on already, AIM patch for inflammation. And I said, no, I don't think I need it. And then after I left, and after about an hour and a half or so, you know, the anesthesia not anesthesia, but you know, the numbing started wearing off.
Overcame.
Then, you know, I started having this problem. So I went and put the ice wave on, right? And on the left, because it was up here that they did it. And then, you know, instead of having to take ibuprofen, like, you know, the dentist recommended, it just slowly just, you know, went away. I mean, I could still feel a little.
Yeah, but it's nowhere near what it would have been.
Nowhere near what it was before. So I said to myself, well, what did this do? Although I've been using IceWave, my wife uses it regularly for a couple of years, I never really, I said, so what is this doing? I can talk to you about X39, I can talk to you about the foot, but I never really got involved with it. So I appreciate that explanation. I'm cool.
Totally.
I'm cool.
Well, I'm glad you're feeling better, and
you're
one step close to the golf course, man. I know you headed over there.
Back, yeah. I'm dealing with a tennis elbow, but you see what's right there.
Yeah, you'll be able to tough it out now. You
Oh,
can
yeah.
Well, thanks for your question.
Thanks,
I appreciate it. Absolutely. Okay, Dale, your turn. Go right ahead. How are you?
Fine, thank you. Thanks for taking my question. And I loved your explanation of the abdominal area.
Oh, great.
Fabulous. I have been doing, I'm pretty sure you said put glutathione on the liver to help detox the liver. Yes. I've been doing that pretty regularly, and I believe it's helping. So kind of exciting. I wanted to ask about a friend's mother. I think she's 85. Okay. She has two different eye conditions. Okay. One has caused almost no light in one eye and very little in the other. Mm-hmm. And the other condition, I'm carefully wording this, has created a lot of blurriness in what is left in one of the eyes. Okay. So originally I had her doing IceWave on masks. Okay. She just had surgery to lessen the pressure in one of the eyes. Okay. And it seems to have helped. So I just thought I'd see what you could suggest for patches for her.
Well, first things first, she's 85. I would be very aggressive just with the patching. I would wear that sleep mask as much as possible, even if she's just relaxing and not going to be doing anything with her eyes per se, put it on. And so what I would do is I would wear, I'm going to say, do as much as you can with glutathione and Eon. So that would be on either eye, stacked together on the inside of the mask, right? So you're going to adhere the patches to the inside of the mask. So if she's wearing the mask like this, the patches would be adhered to the inside, and doesn't matter which direction they're facing, right? Because they're going to be glued not on this side, but on the other side. And as long as they're in close proximity to the eyes, they will work.
Okay.
That should really address, the surface of the eye, because that's where it sounds like most of our issues are. When you have pressure build up, it's because the aqueduct is either there's something genetic there that is not allowing the pressure to release or the fluid to release, or there's some inflammation and damage there that is not good for the aqueduct fluid to leave, and the pressure builds up in the eye. And that's what causes changes or challenges with the vision. Okay. But there's also a lens. You mentioned blurry, cloudy vision. Usually that's the lens. And so you want to have that photobiomodulation going directly into the lens and into the aqueduct. So if you can do that, that would be great. And then I probably would put X39 right here on the third eye or actually underneath the eye. So you can choose. Either you can put the X39 on the mask, or you can put the anti-inflammation on the mask, which is the glutathione and eon. So, but you want to have those three patches in and around the eye, as much as possible.
Okay, so are you suggesting 2 X39s? The right eye is the one with no vision, basically.
Okay.
So would you just concentrate on the other eye, or have you seen things reverse?
I have seen some things improve. Reverse is a strong word. I would say improve. But yeah, obviously I would definitely focus most of the attention on the eye that still has some vision, because you want to maintain that as best as possible. But I don't think it hurts to try to improve the other eye as well, as best as you can. And there's some great eye exercises also, if she's interested. I was taught this in my youth, and as you can see, I wear glasses. I should do this exercise more than I tell people about it. But if you basically strengthen the muscles of the eye, so you're going to look in each of the cardinal directions for 15 seconds. And you should look so hard that you feel the stretch of the pull of the muscle. So, look up and you should feel the stretch, and then look down and you should feel the stretch. And then you look east and you look west. And then you can go in the diagonal direction. So you would look, up and to the left, up and to the right, down and to the left, down and to the right. And so essentially, if you do all of them correctly, you should be doing this for about 60 seconds, give or take. A little more than that. It's about 1 minute and 15 seconds. So do that a couple of times a day, probably breakfast, lunch, and dinner, and just really try to strengthen those, because that will help the eye that has vision to be stronger and more focused when it's looking and focusing. And I have heard that people have been able to regain some of their vision after it's been gone in other scenarios. So try that out and see if that helps as well.
Great. Did you say 15 seconds in each direction?
Correct.
So it's 1 minute and 15 seconds per.
So you have 6 directions. Well, I take that, yeah.
I think that's 8.
8 directions.
So it's 8 times 15.
Mhm.
Is that right?
That's correct.
Okay, great. And then you said it doesn't matter with the glute and the eon, which eye, should she rotate those?
That would be cool. I think that would be probably the best way to go about it. It just depends which ones you want to put on the mask and which ones you want to put on the face.
Okay.
But they need to all be in close proximity to the eye.
So eyes, and then let's say it's her left eye she wants to focus on. So patch on each eye in the mask, and then one on her cheek on the left eye.
So you can do them here underneath. You can do it on the side. Sometimes it's difficult to put it over the eyebrow because the adhesive doesn't stick very good. But those are 3, acupuncture locations around the eye that would help.
Great. All right. Thank you so much, Dr. Jeff.
Yes, ma'am. Great to see you.
You too.
All right, guys. Who else is looking to ask a question, if anyone? We got the core team here tonight. All right, guys. Well, that was short and sweet. We will start shutting things down. It's 8 o'clock. Listen, guys, I have sent emails to everyone on the database about new subscription services that are going to be added to the Ask Dr. Jeff platform. If you did not receive an email and you would like to receive an email, please send an email to contact drjeff@gmail.com. And I will add you to the database, and I will send out some correspondence as soon as possible. Let me put that in the chat. Okay, so that is to discuss some cool things coming down the pipe. We're going to start having some private group sessions to do research, to talk more acupuncture locations, and to have just unadulterated question and answer. So we're going to be doing that twice a month. And also we're going to be creating some Ask Dr. Jeff educational series where we start looking at certain parts of the body and how you can patch for them, similar to what we're doing right now with the anatomy lecture series. But some specific conditions that are really problematic for certain joints or for certain body parts or certain age groups, et cetera, et cetera. So that should be some really great information to take home. So excited to get that started this month. So if you have not made an appointment to discuss how to get set up with our subscription service, I would greatly encourage you to do so. Guys, please like and subscribe to the YouTube channel. There's some really cool stuff that I want to do, but I have to have 1,000 followers. All right. I've only got 517. So if you have not gone onto the YouTube channel and subscribed, please do so. I'm going to be doing some other cool stuff to kind of rev up my subscriber list so that I can offer some other cool perks and things that I think would be beneficial for the family. And yeah, I will see you guys next Tuesday. Thanks so much for your attention. And as always, it's lovely and awesome to share space. We'll see you next week for more Ask Dr. Jeff discussions. Talk to you soon.
Thank you.
Bye-bye.
Thanks, Doc.